Hi, this is Josh. I'm a pharmacist with pharmacisttips.com, here with a quick video discussing cyclobenzaprine. Does it make you sleepy, drowsy, or tired? Real quick before we get the video started, information, not advice. Talk to your doctor, your healthcare provider before you make any changes to your medications, lifestyle, etc. Okay, real quickly, what is cyclobenzaprine? In the US, it's sold under the brand name Flexeril. It is a muscle relaxer. So it's used, of course, to treat muscle spasms. It is indicated for short-term use. It's indicated, the literature suggests it be used for acute conditions lasting 2 to 3 weeks. That's the official recommendation. However, we do see it used long-term with chronic pain, fibromyalgia, certain things like that. We just have to keep in mind the longer we use it, the longer the risk of side effects and things like that. But officially, it's recommended for short-term use, but it is sometimes used long-term. What are the most common side effects? We're talking this happens in greater than 10% of people, 1 out of 10 who take it. Dry mouth, headache, dizziness, and drowsiness. And actually, it's probably more. Some studies show drowsiness occurs in up to 100% of people who take this medication, depending on the dose. So absolutely going to cause some drowsiness, some sleepiness, going to make you feel tired. So certainly something we want to keep in mind. How can we reduce the chance? We want to be mindful of the drowsiness. We got to function during the day. Some people, the lower the dose, lowering the dose, say from 10 to 5 milligrams, can sometimes help. Going to depend on the person, of course, a discussion you have with your doctor to see if that is an appropriate dose with you. Of course, you want to avoid it with any other medications that already cause some drowsiness. The two together can just really reduce your ability to function properly. Absolutely avoid alcohol with this medication. Just not going to do yourself any favors drinking while you're on this medication. You want to use the lowest effective dose. Kind of touched on that briefly a moment ago. So a lot of times people get the 10 milligram tablets, take it up to 3 times a day as they need for muscle issues. Sometimes the 5 milligram dose will provide that same muscle relief with less drowsiness. So something you could chat with your doctor about. Some people just take it at bedtime. They got to remain alert during the day. They got to function, so they just take it at bedtime so they can sleep. We do. It is recommended that it be avoided with the stronger pain medications, the opioids. It is occasionally used together with them, so you have to be mindful that that could dramatically increase the risk of side effects of both. And the older we get, older folks are more sensitive to medications like these, so have to be real careful. You know, if you take this, it could increase the risk of falling and breaking a bone or something like that. So be mindful. The older we get, you just have to be real careful if you use medications like these that cause drowsiness. So I appreciate you watching. Always talk to your healthcare provider if you have questions, concerns about your medications. Ask questions in the comments below. And I do have a more detailed video. It should be a link popping up here where you can check out the full discussion of cyclobenzaprine. And subscribe to my channel if you appreciate videos like these. Thanks again for watching.